Our speakers has not come, so I'm going to compensate for him, hopefully. I'm going to talk to you on back to the wall technique of suturing IOL in the capsular bag in case of Marfan's. You'll find it interesting. Here you can see the lens beautifully dislocated, no question of any doubts about it. The question is, how are you going to handle this case? Make a diamond knife, and we enter, of course, a 2.2 opening at the side with the diamond knife. And the next step is that we have to now empty it out. So what we try and do is we try and move it, and we notice that it is quite, as one would say, beautifully dislocated. We make a small opening in the capsular area. And do a small little rhexis. Once the rhexis is done, the next step is usually these lenses are very soft, so removing them is fairly simple. But once you get rid of the rhexis completely, the next step, of course, is that you have to use hooks to stabilize your lens. So you use capsule hooks, put them in at 4 points, and through that same little capsulectomy which you have done, you hook it on. Capsule hooks are longer. I don't like them because they tend to snag more, so I usually tend to use regular hooks. Once you do that, the lens stabilizes in place. The next step is a little hydrodissection, gets rid of the lens, comes out in front, and a very low, as one would say, low flow phaco to get rid of the nucleus which you have managed to remove. So far there's nothing very interesting until the end, where I'm going to show you how to use that. Clear it up completely. Remove whatever residual cortex is there, because the next day it will float in the middle and creates a nuisance. Then we take a capsular tension ring and inject it in. The secret is to inject it from the point at maximum deflection downwards. So that is then pushed into place when you inject the ring. Make sure the lens is properly dropped into place, and that then stabilizes it. Now comes the interesting part. Just watch it. It's a needle. We put it through the injector. This has got a needle with a proline already on it. And you tie the proline, and first you push the proline needle out and pull it out. Next you tie the proline to the end of the lens which you want, or whatever type of lens you wish to inject. It doesn't matter which one you use. Having done that, trim off the extras. Push your lens in. And now all you have to do is, this is a regular injector, which care group injector is given with any lens, but any injector works equally well. Leave the trailing loop outside. First pull the needle out. And as you advance it in, so you got a needle outside, and you got the lens, and you got the needle suture at the end of the lens. Now you take your needle through the capsular bag and out through the sclera. Now you inject the lens inside. Same time maintaining a little traction onto the Prolene loop which you got in front. So you got the lens in, you got the suture on the end of the lens, and you're putting your loops in, and you're putting your lens inside. Put your lens into the bag which you found. Now what you need to do with this is not to do anything dramatic, just make 4 passes through the sclera. You can either do that or you can put a single suture if you desire. Both of them work equally well. But after you put the passes, just remember to put one last suture to be on the safe side. Remove your capsular bag, your capsular hold rings, and then gradually pull the suture forward as you are doing it, which will bring your lens into place. This is a simple, straightforward way, no gymnastics, no difficulty, anybody can do it. After 2-3 passes, you then place a single suture to make sure it remains locked into place. Adjust it a little to make sure it is properly set, and that is it. So you have, this is one way on which you can suture your lens in without any difficulty, and that's how it lasts. An easy technique. Dr. Dudani, you're next. Thank you for your attention.